Pop Health Podcast is a public service of 24-hour home care. Hello, everyone, and welcome to another episode of Pop Health Podcast. This is Gavin Ward, host of Pop Health Podcast. In today's episode, I sat down with Interim CEO of Keck Medicine of USC, Rod Hanners. Now, some of you that have been listening or watching the show for a while might recall the name Rod Hanners, as he's been on the show a couple of years back when he was the COO of Keck Medicine of USC, but now, again, he is the interim CEO of the entire health system, Keck Medicine of USC. Rod has a background in the Navy, where he was a submarine commander, and I asked him on the show how his experience from the Navy and his time as a submarine commander might have helped him be prepared for the pandemic that we now face today, and leading his team there at Keck Medicine of USC, which comprises 3 hospitals, a medical group, and much more. We hope you learn from today's episode and check out other episodes of Pop Health Podcast by visiting us on YouTube, Spotify, Stitcher, Apple Music, and of course our website, pophealthpodcast.com. Thanks, everybody. Enjoy the show. Well, Rod, it's been a few years. Thanks so much for rejoining the show.
It's good to be back, Gavin.
Awesome. So we're recording this during the holiday season, and we just talked a little bit about Thanksgiving off the air, which Rod was very good off the air. He was still very good in his backyard. So for all of you listening, he's definitely adhering to all the protocols, which is a great example for all of us. Rod, we always like to kick off each show by getting to know you or the guest. So would you mind sharing with the audience something outside of maybe the healthcare world about yourself?
Let's see. I usually go with my go-to, Gavin, as you know, in terms of, I didn't follow the traditional rank up through college and then into healthcare. I took a little detour with the submarine force, getting out of college, spent about 8 years with the submarine force as an officer on a fast attack submarine. So that's a surprise, but may not be a complete surprise to everybody. So let me think of something else here. And I guess, I lived both in Southern California growing up as well as Alaska. So I spent my summers in Alaska and my winters in California. My dad lived in Alaska, my mom in California. And so I got the best of both worlds, I believe. And so that's stuck with me over time. And now my girls go up there with me, and we like to salmon fish in the summers. And so we have some friends that are still up there. So that's probably the new surprise of the day.
That's awesome. So how long are those summers? How much sunlight do you get when you're out there in the summer?
When we'll go in June or July, it doesn't get dark until maybe 11, 12 at midnight. Yeah. And I remember growing up, it was always crazy because I'd be in bed. My dad would get us into bed at 8:30 or whatever in the summertime. And I'd hear my friends outside all playing baseball at like 8, 9 o'clock at night, which took some getting used to.
That's really neat. Cool. So one thing about Keck Medicine of USC is it's a little bit different than what some people may think when they think of a health system or hospital system. So could you remind the audience what Keck is and maybe some of the things that's different about a traditional hospital system?
Yeah, well, so Keck Medicine is the brand name of the system. The corporate name is USC Health, which is kind of the corporate name that we established toward the end of November when we set up a different board for the health system. So that was something that was unique to us that is now no longer unique, and that we have stood up a health system board with trustees, both from the university as well as from the outside, that can provide the level of governance with some notion of what healthcare is. And so we've stood that up. So that's new for us. But so Keck Medicine is really comprised of 3 hospitals, 3 acute care hospitals as it stands today. 2 of those are on the health science campus, and that's Keck Hospital, and then Norris Cancer Hospital. And then we have the Verdugo Hospital that was acquired in 2009 that is up in La Cañada, Flint Ridge area. And then we've got the USC Care Medical Group, which is part of Keck Medicine. And so the medical group is part of the entity with the clinical departments that fall within USC Care Medical Group, who also are members of the Keck School of Medicine. And so those are the 3 main entities, if you will. The Keck Medical Center, which is on this campus, which comprises the 2 hospitals on this campus, and then Verdugo Hills Hospital, and then the USC Care Medical Group. That, as of today, comprises what we call Keck Medicine of USC.
Okay, awesome. And then does USC Health have other parts of it, or is that pretty much all for USC Health as well?
Well, that's USC Health is the corporate name for that new corporate entity that we're working on right now. But the governance of the health system board also oversees clinical activities that do not occur underneath the Keck Medicine umbrella. For example, we have several schools that provide clinical services, such as the School of Dentistry, the School of Pharmacy, the School of Social Work, et cetera. And so their roles and responsibilities of our fiduciary board are to oversee those clinical activities as well. That was one of the big drivers for the new health system board.
Okay, awesome. That's a good explanation there, Rod. So you are currently the interim CEO. Am I getting that right, or has that changed since I last checked?
That's correct. That's my third hat these days is the interim CEO for Keck Medicine of USC for the system.
Yeah. So how does that interim tag or role, how does that differ from if you were the CEO? Is there any change in the day-to-day, or are you pretty much doing the exact same thing?
Well, I think, a lot of folks approach an interim role differently. I approach it as though you got the job. And so there's nothing that different in terms of how I'm acting in the role just because it's still an interim. And so you own it at that point when you become the interim, and I carry out the same decisions as though I was in that seat permanently. And so, yeah, so I don't see a difference, in at least the way I've approached it.
Okay, thanks, Rod. So one thing, since you've last been on the show, well, especially this year in 2020, is there's been a lot of good things from a press perspective with LA winning championships. So, of course, the sports, the Dodgers, the Lakers, and USC continues to win accolades by ranking high in US News and World Report. And there's a lot of competition, right? There's a ton of competition here in Southern California in the state. So can you tell me what goes into winning those accolades?
Yeah, I think there are probably three main ingredients that I would turn to in terms of, it's pretty unprecedented for a relatively immature, new academic medical center to reach the top 20 in such a short period of time. And so as we've looked at it and said, okay, what was the secret sauce? What was it that really got us here? I think three things really jump out to us. First and foremost, it's the quality of our faculty, our physicians. What we've been able to recruit over the last 4 or 5 years, actually longer than that, last 8, 9 years prior to my time. So I think that is a huge part of it, is bringing in some very talented physicians and then really creating an environment for them to excel in. And so that I would say is one major one. The other one is around the leadership team that we've assembled. And I think it's all about leaders and their ability to motivate and move on certain agendas and again, help to create that process of improvement. And then just an undying focus on quality. I mean, just very, very focused on our quality and our outcomes. A lot of work by our CMOs, working with their teams. And then when you bring all that together, leadership, faculty, this focus on quality, and create that alignment, I think that has been a real focus of ours, is to make sure that we are all 100% in alignment on what winning and losing looks like, and then where we need to put our efforts. And it's been a joy working with our faculty in that regard, because we're very, very, very aligned in that regard.
Awesome, Rod. Well, continued success to you. And as I shared previously when we've had you on the show and past predecessors, my brother-in-law received great care from your facility, and many other family members as well. So I can attest to that, and it's been neat to see. So one thing I want to talk about is, and you touched on it already, Rod, is USC or Keck Medicine of USC. I always get the wording incorrect here, but you guys don't have an emergency department there in your Los Angeles campus. So why is that?
Yeah, that's I probably get asked that question monthly, and it's not an exciting answer, because we really don't know why, right? I mean, it was a Tenet facility before the university purchased it up from Tenet. the word has it that back when Tenet was looking to create the hospital, LA County USC is, a stone's throw away with a very large emergency department. And so emergency services didn't seem like it was a community need at the time, is what I've understood. And so as a result, the folks at Tenet, when they built the hospital, built it without an ER. So that makes us, I think, one of the only academic centers in the country without an ER at their main flagship hospital. Although if you talk to our department chair of surgery or department chair of neurosurgery, they want an ER.
Yeah,
you can imagine. Yeah, as well as our cardiology folks. So at any rate, we look at it. We always look at it and say, will that make a big difference here with where we're sitting? And so it is a constant conversation here as we think about our future.
Good point. I appreciate your honesty there, Rod. So you mentioned LA County USC Medical Center. And for those of you who haven't been to Rod's organization or physically in that area, LA County USC Medical Center is within walking distance. And it's a separate entity, even though it has the same name. You might, if I don't know if you know the answer, but what's that affiliation? How does it differ from yours?
It's a separate organization, LA County is. So not a lot of health system to LA County in terms of any sort of thing that we have any oversight over, if you will. Part of the county system. I'll get to the question in terms of the naming, but what we have is our School of Medicine and our physicians have a contract with the county to provide clinical services. They call it an MSA. So it's an agreement for professional services, like you would have in a PSA with anyone else. Where they're very linked is around the training program. So we are joint sponsors of the training program. It's actually the university in LA County when you think about the bigger piece. And so that they have a joint, one of the only in the country, right, in terms of a joint sponsorship for GME training. And so that's my guess is that's why the LA County USC name was on there, was probably at the time of the training programs being so heavily linked, and obviously the professional service agreement with the faculty.
Awesome, Rod. Sorry to throw that one on you, but I was just very curious, and I know a lot of the public is. So you have the two different hospitals. Can you tell us about your specialties there?
Right. So, we have all the specialties you would imagine, plus some. I think the things that differentiate us are really some of those higher tertiary quaternary type services. The aortic dissections that come our way in the night, with potential ruptured aneurysms, and we have a lot of work that goes in there. That's kind of one of our hallmark programs where our vascular surgeons and our cardiac surgeons work together. Which is unique, right? And they get along actually, and work together on their cases. We have one of our vascular surgeons that builds stents way up into the aortic arch, and he builds them by hand. So he'll get a patient that comes in, and he'll build these arches that go way up into the upper arch, and these stents that. So we have a great program there. He's obviously got all his credentials on the physician side, but also as a degree in biomedical engineering, where all the skills come together. So that's a really great vascular cardiothoracic surgery partnership. A lot of great neuro activity here, whether it be epilepsy or other neurosurgery or brain tumors. We've got some really, really talented neurosurgeons. Obviously, the transplant area is something that we differentiate on quite a bit, both all solid organs, and doing very well in the lung and in the hearts, and also the livers and kidneys. So a very vibrant and a very active with great outcomes on our transplants. So by and large, what differentiates probably Keck Hospital and Norris Cancer Hospital is our case mix index.
Okay.
We're part of Vizient, which is a lot of academic centers across the country. We have the highest case mix index in the country. It's up around 3.2, which is a pretty high case mix index. So a lot of high acuity cases here. So we look at ourselves as the specialists to the specialists. So we're the super specialists that help a lot of the community specialists in terms of these higher levels of care that we have some expertise in. So highest transfers. So there's a lot of transfers, secondary transfers come from the community to us because of the unique services that our faculty provide here. And as you know, and folks that are on this call know, a surgeon or doc is one thing, but the care that surrounds them with the respiratory therapists, with our physical therapists, with our occupational therapists, with our nurses, our nurse practitioners, our PAs, it takes the whole team really to create the kind of experience and deal with the level of care that we're dealing with. And so that's kind of our niche, if you will.
Yeah, no, definitely. And you guys definitely have some tough to fill shoes, I would say, with the specialists that you have there. I remember right when Tenet sold to USC, early in my career, I helped place travel nurses. And for those of you in the that are listening, most organizations, have their own staff and don't necessarily need outsiders. But every once in a while, if a nurse goes on maternity leave or they have a really good specialty and they might need some extra support, so my company would help occasionally bring in a specialist. And it was so hard to get the right fit because the skill set that you guys have there at USC is so unique. So that was my first experience with USC. I remember the nurse manager was Lisa. This was before your time. And
yep.
she wanted to make sure she had the best. And it was tough to find that. But yeah, really, really neat place. So you talked about the Verdugo Hills acquisition, which it seems like yesterday for me, but man, you mentioned 2009. So that was 11 years ago. Do you happen to have any info on what inspired that acquisition? That was 11 years ago.
Yeah, and I may have thrown out the wrong date on that. I think it was actually later than that, to your point, Gavin. It was 2009 when the university bought the Tenet hospitals.
Oh, I'm sorry.
Yeah. No, I may have misspoke. But yeah, I mean, the interest was to grow the system, really, in terms of being able to move into different communities and continue to grow. If you're not growing, then, it's difficult, right, to continue to make ends meet. And so that was a target. It was before my time here, but, I think the benefit has been great for that community. I mean, I think we've raised the level of care in that community. We've brought, some of our faculty certainly into that community and intermixed with the community physicians. It's still a very community-based hospital. And I think, with the leadership that we put in there, increasing the level of care, and then just the quality and the safety, I think has been really, it's been fun to watch and see how our CLABSIs and CODIs and all those sorts of things are just kind of dropping because we've put in the right processes. And part of that there, to your point on travelers, when I first came, there was a lot of travelers in that hospital. And sometimes that could create some challenges around quality of care and just, keeping everybody up to speed on what the protocols are and what the bundles are that you need to be driving. But so they've worked very hard on that and bringing in the right talent and then bringing in the right physician talent and, with the right hospitalist, the right laborist, the right intensivist, and the ED changeover that happened there. I think it's one of the best run EDs in the county in terms of the faculty there that are driving that. So a lot of really positive things at Verdugo Hills Hospital, and continues to climb.
Awesome, Rod. Thank you. So COVID is, I don't want to say over-talked because obviously it's probably the number one important healthcare matter in the world today. So while we don't want to have the show be a big focus on COVID, we do want to ask you how it has impacted Keck Medicine of USC. And it's been, we're recording, pretty much early December now. So it's been 8 months or so since COVID has really impacted our society here in Southern California. Looking back, what are some of the things that stood out to you about how you guys have responded to the pandemic?
Yeah, I think it's not unlike many of the health systems that, we all keep tabs and have certain calls, that many have gone through. I think, it was tough going there at the very beginning. Just the level of, we had meetings, I think twice a day, driving protocols, and as the evidence continued to shift and new guidelines would come out, you'd have to tweak those and trying to communicate those out to the workforce and making sure that we're creating the safest possible environment for our workforce to come in and deliver care to our patients. was paramount. That was our North Star, is that everything that we're going to do here. And it was touch and go at the beginning because it was tough to get the right PPE. And so you had to, you didn't ever want to compromise in terms of safety, but you don't want to run out of your PPE. So we were like day in and day out, just kind of nurturing this thing. And then, and took some risks early on. One of the things I think we're real proud of is we never relaxed off droplet precautions at the very beginning of this, even though there was some notion coming out that it wasn't, transmitted via airborne. But we said that I haven't seen the evidence, and we're not willing to put our folks at risk. And we had at least the luxury of having enough N95s to be able to back that kind of protocol up, and then work feverishly trying to get more PPE in at that time. I think I was on daily calls with our materials management, just looking at getting authorized, where things were costing 10 times X, pre-COVID, and saying, we got to get it. So I think that's the luxury of having the university behind us, as well as, just having some scale. It allows us to go and take some risks and pay maybe more than we should, but still, we never got into a position where we had to compromise on the safety of our workforce. I think we're very early. We're the only ones that we tested every patient that came in for whatever procedure, as long as it was aerosolizing procedure, or it was coming in to be admitted, or coming in for surgery, we pre-tested. And then again, we had the luxury of worked real hard to stand up our own testing capabilities, and had to try to cajole folks to give us the reagents we needed and all that. So that seems like a distant memory, but we were like everybody else, plowing along, just really trying to make sure that we created a safe environment for our workforce. And as we monitor all our statistics and look at the number of positives amongst our staff, and 99.9, you'll hear this from a lot of folks, is really community acquired.
Yeah.
And, the screening that we put in right up front with manned screening stations, so folks coming in got screened. We went to universal precautions with masking long before it was in vogue, to do that because, again, of the PPE issue.
Yeah.
And so I feel really good about what our leadership team accomplished throughout all this. And I think we're a few weeks, if not a month, out in front of the pack. And I think it's because of the leaders we had here really working day and night to get us the resources that we need to be able to really protect the environment for our staff. And that played out very well with our staff, with our physicians. We still couldn't get enough PAPRs fast enough to be able to do some of the higher risk procedures in PAPRs, but we had enough to where we were able to stage out the cases such that we made sure that our ear, nose, and throat physicians, as an example, were always protected when they were in doing a risky procedure, if you will.
Nice.
That was a little bit before we had testing to really know, and so we had to treat everybody as though they were positive. But luckily, when the testing caught up, we were able to test a lot of our folks, and then all the work in the environment, the telehealth, we were doing a tremendous amount of telehealth, continue to this day at about 30% level of all our visits now remain telehealth visits, and so a lot of good stuff. I think the thing that I like the most, it really engendered a sense of us, and a culture. And I think, disparate groups that maybe not have worked as closely together had to come together across the continuum, and so forge new relationships, forge new trusting relationships. And I think overall, there's a silver lining to it all relative to what we've been able to accomplish as an institution. I think people are pretty proud. They're tired. By now we'd kind of be, and now it's starting to ramp itself back up here. And so people are ready to go. But I think the tough work's over. Now it's a matter of tweaking. And when do we bring these things back online with where the second surge or third surge, however you want to count it, is going. So that's kind of where we're at right now with, a lot of anxiety in our workforce, just in terms of what's happening out in our communities.
Yeah, it makes sense. And I wanted to ask you, you mentioned your history in the military and on a submarine. And, one of the phrases out there in leadership is like a calm pilot. And I'm curious if any of your military training has helped you react during the pandemic and maintain calm.
Yeah, I think in times of crises, right, you kind of centralize decision-making a little bit, right? So that you're making sure that you are able to make the right decisions. You don't have a luxury of building Noah's Ark, right, and waiting for consensus and all that. So you just got to go off the evidence. And so I think that's certainly like battle stations in the submarine force, or whenever you have some sort of crisis. So, but it's all balanced, right, in this environment. And I think we have large, we call them COVID strategy meetings with all of our key leaders across, and we made a lot of sausage in those meetings, in terms of documents and looking at workflows with our medical evaluation tent, our paths of travel, our testing protocols. To say that we pre-test people before they come in, that's nice to say, but somebody's got to go implement workflow around that in a way that gets people here with 72 hours in advance of theirs. So that's 2 trips out to the medical center, and we draw a lot of patients from afar, and so all of that had to be worked out, and that's just my hat's off to our leadership team and the directors and the associate administrators and all those that rolled up their sleeves and really jumped on it. And that's spreading out in environments when we started to kind of emerge out of the initial COVID wave in mid-May. Just a lot of work and looking at schedules and looking how we space out, and then continuing to kind of stabilize that telehealth environment is a big area of focus as well. So it played in, I think, a little bit. At least that's my, and I happen to have a pretty stellar leadership team in the CEO of the hospital, as well as CEO of the medical group, who's also my CEO, the interim CEO of Keck Medical Center, right? Well, I did that. A guy named Marty Sargent, and he was an F-15 fighter pilot. And
so nice.
He has calmness in his veins as well in terms of dealing with some of the challenges. So, yeah, I think stable leadership and keeping your eye on the prize and being calm and having humility, I think, is a big part of it as well. In terms of you don't know all the answers. Nobody does. It's all brand new stuff. So just listening to the wisdom and keeping that North Star present in terms of safety of our workforce, and that's kind of how we've positioned it. And then through those practices, masking, distancing, washing your hands, it actually works.
Yeah,
very well in our environment, and so that's been our biggest pitch, is to say, don't just, where we've had some healthcare worker to healthcare worker transmissions, it's been because people let their guard down and had a party, and somebody was positive from the community because somebody in their family has been the biggest case. Somebody in the family, and then and then people, I always get allergies this time of year, and so ruling out sometimes when you should have played it very cautious. So it's just constant reinforcement, constant communication, constant education. And making sure folks are being as vigilant as possible. It's never over. It's continuous. You got to keep kind of pounding it home, and when people start relaxing their guard a little bit is when things get a little bit scary.
No, absolutely, Rod. Some good feedback there. So lastly, as we wrap up today's show, the last question I have for you is we're recording just a few weeks after the recent election, and do you anticipate any impacts to your organization in the near future with Joe Biden becoming the president and his administration leading the way, or do you feel pretty much everything will continue on the same path?
Well, I think that's the multi-million-dollar question, right? And I don't know, right? I hopefully it's positive for us. I think for the healthcare community as a whole. There's a lot of moving parts, though, right now in terms of whether it's price transparency, whether it's the 340B assault, that's happening on the 340B program from all angles, from manufacturers, from commercial payers, from the federal government, from so that's a big one, I think, for some of the big hospitals that have a 340B program.
Could you share briefly what is the 340B program?
So that's a drug discount program that allows certain qualifying hospitals to purchase drugs at a lower price point than others. Okay. And the idea is to be able to continue to use that margin, if you will, to provide services to more of the Medi-Cal population.
Got it.
Good. That's a really gross simplification of it, but it's a big program for many hospitals in the country, and certainly for a cancer hospital, although they have certain grandfather privileges. But at any rate, it's a big program, and it's getting a lot of attention lately. And there's a lot of movement up front with white bagging, at least for the commercial payers, with the reduction in the reimbursement from the federal government, with not being able to use contract pharmacies from the manufacturers. And so health systems are kind of getting hit from all angles. So hopefully Biden can help us out there a little bit, but that's my hope. But there's a lot of other things, right? I think relaxation of some of the standards that were relaxed a little bit over this period, and hopefully they can stay relaxed so that we can continue to do the right thing for our patients without old regulations that are governing us. And certainly in the state of California, Title 22 is ripe for an overhaul, and hopefully some of this that's happened through COVID maybe can stay. And that's what we hope, at least from the federal government, for Biden to kind of help nurture that as well.
Awesome, Rod. Well, thank you. And lastly, I want to end on a note. Is there anybody at your organization, you don't have to name them, or a patient story that over the last 8 months or so that's really stood out to you as a success story, or how you guys overcame a challenge? Love stories. Go ahead.
I get a lot of, I grew up in the South Bay, as I mentioned earlier. So I have a lot of friends and family in the South Bay, and a week doesn't go by where somebody hasn't reached the end of their rope relative to trying to get a diagnosis or what have you. So the story I'll tell you is around a friend of mine that I coached his daughter when I used to coach softball. And I got a call from another friend that said, "Hey, have you talked to so-and-so?" And I said, "No, I haven't talked to him in a while." And he said, "Oh, he's not doing so well. He was over at XYZ hospital, and they couldn't diagnose him. And so they just sent him home. And hasn't eaten in 3 days and all this sort of stuff." So I called up their family, and I said, "Hey, it was a Friday night, right? So it was always the case, Friday night, and I said, 'Hey, I'll get him in on Monday, get him to see who he can be seen. But if you need anything sooner than that, let me know.' And certainly Saturday morning he was at his wit's end and wasn't feel like he was going to make it. He's eating a half a strawberry a day. So long story short, brought him into Keck. And it's just been, he got diagnosed within several weeks of being here, a lot of tests and all that, and got him the diagnosis, got him the therapy, got him into rehab to help rehab, and went home about a week ago. And that could have been a much different story had friend number 2 not called me to get him in here. So, and that, Gavin, happens every day here, every day. And I tell you, that's the one thing that surprises me the most. I was at Children's Hospital Los Angeles before this and provided really great care to the children in Southern California, but also across the nation. And the amount of letters and accolades that I get today at Keck Medicine is amazing in terms of the experience that folks have had with very complex situations. And so I could go on and on. But anyway, yeah, that was a great story for a friend of the family where, and I know folks did their very best because that's who they are, not because it was a friend of mine.
Yeah.
And because we kind of kept that under the lid as much as we could. So at any rate, that was a great story. A really wild diagnosis, West Nile virus. Imagine that.
Oh, wow.
So and it was funny. He goes, "I haven't been in the West Nile." So anyway.
That's awesome. That's awesome, Ron. I appreciate you mentioned keeping that under the lid a little bit about that this patient was connected to you.
Yeah,
I appreciate that. And I think all of us as leaders, like sometimes even at my own day job, sometimes we're like, "Oh, this is a VIP patient because they know so and so," and we have to resist calling anybody VIP patient because everybody, right? Everybody should be a VIP patient. And it touches me. Last week, one of my friends, one of my best friends, her father-in-law passed away, and my company took care of him in his last year and a half. And my ops manager who coordinated all the care for this gentleman, when I told her, I'm like, oh, he passed away. I'm so sorry. Can we, let's make sure we do flowers, all this stuff. And she found out that the gentleman that passed away was one of my mom's best friends, stepfathers. And she's like, how come you didn't tell me? And like you said, Rod, it's our responsibility not to necessarily tell everybody because we want to treat everybody the same and they should get great care no matter what. So
right.
That's a little tangent, but I just want to say I very much respect what you said and I'm glad that you kept it under wraps.
Yeah, no, it's good. And that's exactly it, Gavin. Our staff, they don't differentiate the level of care that they provide to each of our patients. They give it the best to everybody, right? Everybody's a VIP. Now, certain VIP, maybe you get a little accoutrements here and there, but as far as the clinical care, it's standard, right?
Exactly.
So,
yeah. Awesome, Rod. Well, hey, really appreciate you being on the show. If people want to keep up with you, Rod, are you active at all on any social media or LinkedIn, or how can people kind of follow you at USC? Yeah,
LinkedIn, Gavin. I'm on LinkedIn. I got Twitter. So I got all the bells and whistles. Oh, Instagram here and there. So yeah, I was a resistor early, but now I'm a social media guy. So I wouldn't even go that far, but let's just say I'm on social media.
Awesome. Yeah, I follow Rod, and he's not every day, crazy, but he's definitely consistent. So I can appreciate that. And then Rod, how can folks learn more about USC? What's the best? Obviously, they can Google it, but what's the best website to go directly to?
Yeah, I think Keck Medicine of USC. I think if you just Google Keck Medicine, we're always advancing and raising the bar on our web presence. So click Keck Medicine and click often.
Awesome. And if people want to work for Keck Medicine of USC or see their job openings, would they just do the same thing?
Yeah, it'll be there on the website as well. Absolutely. But feel free to shoot me a resume if you see jobs that are open. I'd be more than happy to shuffle them all, make sure folks get a look.
Awesome. Well, folks, again, Rod Hanners has been our guest. Great to have you on again, Rod, and best wishes as we turn the corner to 2021.
You too, Gavin. Nice seeing you again.
You too.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.